Hello, everybody, and welcome to another episode of Mind Matters, Navigating Head Injuries and Concussions. I'm your host, Kiley Como. I'm the legal nurse consultant here at Shane Smith Law, and today on the show, we're joined by Zach Smith. Zach is a highly experienced speech-language pathologist with over a decade of experience helping individuals with neurologically based communication and swallowing disorders. Trained at both Boston University and the MGH Institute of Health Professions, Zach has worked across a full continuum of medical care and brings a deep understanding of how to best support patients on their recovery journey. Now serving as a clinical director at Constant Therapy, Zach is on a mission to bridge gaps in care for people across the U.S. and beyond. He works with clinicians and patients directly, expands access to cutting-edge digital therapeutic tools, and champions innovative ways to make therapy more effective and more accessible for everyone who needs it. Zach, it's great to have you on the show today.
Great to be here, Kylie. Thanks for having me. I'm excited to speak with you today.
Yeah, we are too. That said, we have had all sorts of guests. We've had neurologists, neuropsychologists, we've had some survivors, but Zach, you bring a unique role and perspective, and because of that, I don't think just one episode is going to do it, so we're going to make this a two-part episode, okay?
Sounds great.
All right, so let's dive in. We're going to learn a little bit more about your expertise in particular. Zach, let's start with kind of the basics. What is Constant Therapy?
So Constant Therapy is actually an app-based platform that houses the world's largest digitized and evidence-based library of speech, language, and cognitive linguistic exercises that people who've had various different neurological events can access and use as primarily supposed to be as an adjunct to their speech therapy sessions, but just given the climate of a lack of resources in the U.S. right now, and a shortage of speech language pathologists, sometimes the program can become the sole means of therapy for some individuals.
That's excellent. I looked across your company's website, your team's website, and it looks quite interesting, very innovative. I love what you said about kind of the lack of these types of providers, speech pathologists. It's a very niche role, but it's so needed, especially in the world of brain injury. A little follow-up to that, how has Constant Therapy kind of evolved since its inception to address changing needs in neurological rehabilitation?
Yeah, so I mean, the company's been around for a number of years now. And, in that time, we've seen new exercises come through the program. We've seen, increases in the artificial intelligence component of the program. I'll use your word, Kylie, evolution, where when people with brain injuries are going through the recovery process, we know they're going to evolve. And Constant Therapy as a tool will evolve with them. Their performance directly changes how the program interacts with them. It might make the exercises a little harder. It might make it a little easier if they're, in a slump or for, whatever reason, things are just a bit hard. But we fine-tuned that. There's quite a bit of changes because we know you can't keep doing the same thing day in and day out when you have a brain injury. You need to keep things moving. You need to keep things fresh. That way the brain has something new to learn and can continue to work towards, improvement.
That is very, very interesting. Yeah, I was really curious about how that, I know during COVID, telehealth was all the rage. It's become quite a useful tool. Again, going back to your initial statement of, lack of access, it's opened that up for quite a bit of people. As a matter of fact, just based on what I'm seeing on your platform, it's available pretty much anywhere you can have the app and an internet connection and a device to get on that. Is correct?
At the present moment, yes, we are restricted to more like tablets and smartphones, but we're actually in the final stages of developing a web-based version of the program where anyone with an internet access can do that. So that's hopefully going to be available by the end of the year, and the goal is just, again, increasing access and making sure people who need therapy are able to get tools to do it.
That is fantastic. Very exciting. So let's dive into kind of your realm of expertise, right? Speech pathology. My background is in neurosurgical ICU as an ICU nurse. Took care of a lot of strokes, subarachnoid hemorrhages, all that sort of thing. Aphasia was always a very prevalent symptom with those sorts of injuries, if you want to call them that. But speaking of brain injury in general, what is aphasia? Let's talk about that for our audience.
So aphasia is an acquired language disorder, and we like to stipulate that acquired piece because generally people who have aphasia, their language system is developed, from birth on up through whenever they have their brain injury. And then they have this brain injury, their brain, the brain areas that control language, either production or comprehension, are damaged, and that results in this aphasia. So it might impact a person's ability to say the right word. It might impact their ability to use grammatically appropriate sentences. Sometimes they might do something that is referred to as word salad, where the kind of cadence of what they're saying might sound like speech, but when you're really listening to it, it doesn't make sense. It can also impact their comprehension. So they may have difficulty understanding, anything, to the more severe forms of the disorder, where just, a word here, word there is what they can understand, all the way up through they might be able to understand more complex sentences and miss just, a single word here that might throw off, their understanding. And that's more on that kind of spoken end, but it also does impact more written. So, you can have an aphasia where your writing is impacted. You might not be able to spell words appropriately, or use words incorrectly in sentences. You might be unable to read or understand what you're reading. So kind of in those four realms of expression, comprehension, reading, and writing are where aphasia lives.
That's great. You touched on, what I was hoping you'd get to, the different types of aphasia. It's a general term, but you dug down well. So in terms of the differing types of aphasia we're talking about, in terms of symptoms, how do you approach that with the rehabilitation approaches that you and your team and your platform use?
So I think a good kind of upfront general answer to your question on how to differentially diagnose, that is very dependent, because there's no universally accepted by every practitioner model of how we're going to diagnose this. So sometimes you might hear the term expressive aphasia or receptive aphasia, and when they use that term, they mean that more of that expressive speaking and understanding end is impaired, versus a receptive aphasia is more that comprehension end. On my end, and I know that I speak for my team as far as how we tend to look at things, I like to go a step further, and I use something that's referred to as the Boston classification system. And with that system, that looks at different levels of a person's abilities in terms of kind of starting at the top. Do they have fluent language or non-fluent language? And by that, it means, are they able to speak in complete sentences? Does language flow nicely? Or are they kind of at the other end of the spectrum, where they might have what's called telegraphic speech, where, kind of the articles of speech, the A's, the thes, those sorts of words, they might not be able to produce those, but they can produce more content or content words. So that kind of is that first range. And then we look at what we refer to as their auditory comprehension. Again, how well they understand things. Is that intact or not? And then lastly, it's their ability to repeat, because that can actually show us how certain systems in the brain are functioning. And between, those three levels, so the fluency of their speech production, their comprehension, and their repetition, there's actually multiple different kinds of aphasia that a person could be diagnosed with. And they range in severity, again, from everything could be impacted to, if you didn't know any better, a person with a higher level, what we would refer to as a mnemonic aphasia, they might be able to pass, quote unquote, as not having an aphasia to someone who doesn't know. So you can see there's quite a range of severities that can be represented.
I think, we have a lot of, clinicians and people who may be more adept with some of this type of information that do watch and follow our show. But like I said before, we also have we've had survivors on as guests. We have survivors that watch. We have people who have a loved one who is going through a brain injury rehabilitation process. So for that latter group, could you kind of talk about the brain? Let's dig a little bit in brain anatomy. If I have a brain injury, is there a certain part of the brain that I need to be worried about when we're talking about aphasia and that sort of injury?
So generally speaking, and I'll kind of use, the size of my head here. So generally speaking, the language systems are in the left side of the brain, so the left hemisphere. And I say generally speaking because there are people who can have their language system on the right side. There's some research that shows that people who are naturally left-handed might be more likely to have it on the right side. But when we're looking at the left side, we're looking kind of, traditional thinking is two main areas, and then there's also the connection between those. So the first one is Broca's area, which is kind of right up front here, and that's where your ability to produce speech is held. Or housed, I should say. So if you have damage in that area, that might result in more of the non-fluent forms of aphasia. So we're thinking of, a Broca's aphasia, where they do have that kind of halting, choppy speech, but their comprehension is pretty good and intact. They might also have, something that kind of mirrors that, where it's a transcortical motor aphasia, where it's pretty much the same. The speech is halting, the comprehension is good, but the repetition is intact in that form. The other area of the brain that we look at is a bit further back, kind of here in what's called the temporal lobe. So kind of, right, if, looking this way on my head, right behind the ear here. That's where comprehension is generally housed. And if people have damage to that area, that's where they might have more of the fluent end, where their speech is generally okay, but they might have more difficulty comprehending what people are saying to them. And then between those two, there's a pathway called the arcuate fasciculus. That one also can be damaged. That can, range in severity, range in different types of aphasia. But generally speaking, if we're talking just about aphasia, we're going to be looking at the left hemisphere and then kind of breaking it down from there.
I hate to use the term fascinating when you're talking about brain injury, but those aphasia type symptoms were always just that. They're fascinating to see manifest. So when you look at an MRI and then you look at the symptoms a patient presents, doesn't always line up necessarily and anatomically with kind of the symptoms you're talking about. It's like every brain injury is a snowflake almost. And I think
100%.
Yeah. It's just, again, I hate to use it, but fascinating. The
brain, it's a fascinating organ. And like you said, I think calling it a snowflake is more than appropriate. You can have someone who, if by some means you could recreate the exact same brain injury in the exact same area of the brain, that they may not even have the same issues. Very unlikely to have the same issues, just because everybody's brain functions differently.
You and other providers we've had on the show, it's this common thread we see running through here. Although there are, typical symptoms we think we may see, and to certain, if there's an injury to a certain part of the brain, the therapies, as you've kind of started explaining with Constant Therapy Health, have to be very tailored to that individual, as far as what they're manifesting to you, not necessarily what you're seeing on a film or in a diagnosis or whatnot.
Oh yeah, 100%. On my end as a speech and language provider, I might use some of those MRIs and CTs as far as just identifying, okay, there's left-sided brain damage that might tip me off that there could be a language problem. I'm going to want to assess that. Or if there are, there's damage more to the front, the frontal lobes kind of right here in the front of the head, that could be more on the cognitive end of things. So I might want to think about looking at that. So, it influences what you might do. But again, you really never know until you're working with that individual.
Yeah, agree. In terms of aphasia, are there any, let's talk about acute aphasia. So kind of close after the injury, what are the short-term effects of an aphasia diagnosis after a brain injury? Yeah,
so short-term, when a person's in acute, unfortunately, obviously they're going through a lot more than just that aphasia. So, they might have had their stroke or brain injury, not remember having that happened, and then kind of come to in the hospital, and suddenly they're in a hospital bed surrounded by nurses, doctors. I show up and here I am with, my, to them, my funny pictures and trying to get them to do something, and they may not understand fully what's going on. So there can be a lot of, I'll use the word misunderstanding on the point, on the part of the person with aphasia, where they just may not understand what is going on. And that's not their fault by any means. That's just the brain reacting to the situation that it finds itself in, and there can be confusion. It's a novel situation. And there can be a bit of that kind of barrier to really get through, and I'm sure that you saw that on the end of the neuro ICU when patients are coming to, and they can be combative. Yes. They may not want to work with you, things like that. So that can be kind of one. The other short-term effect, I'd say at more of the acute level, is when we're getting ready to get out of the hospital. I think that the aphasia can come back into play there as well, where's that person going to go after they're discharged from the hospital? Because we know not everybody's going to go home. Someone with a more mild aphasia, they might be able to go home because we might feel comfortable with their ability to communicate at home. The big one that I think of, and I'll tell my patients and family members, is if for whatever reason that person was left alone and they had the medical emergency, do they have the language skills to call 911?
Yeah.
If not, that could be catastrophic. Versus, someone who might not, they might need to go to rehab and work on that aphasia at that rehab level. And obviously speech therapy is not the be all end all as far as that decision goes, but that's part of that interdisciplinary discussion, especially when an aphasia is present, is, how is this person going to navigate their environment? But kind of in between those two, I went for the extremes of just waking up to getting ready to go out of the hospital.
Right.
It can impact their entire stay in the hospital. If they're working with another medical provider, let's say physical therapy or occupational therapy, they might not be able to fully participate at that level yet because they might still be working with a comprehension issue and may not be able to understand the directions from the therapist, which can impact how far they can go in their therapy at that point in their recovery. They can also feel a great sense of frustration at that level where they know aphasia does not impact your ability to know what you want to say. It's the ability to get it out. So the fact is, the person is sitting in the bed in the hospital and they know what they want to say, they just can't get it out. And the fact that they can't get it out can be frustrating. The fact that they think they might be getting it out, because that can also happen with aphasia, where to them they're totally making sense and we're getting a lot of confused stares back at them. That can be frustrating because there are those communication breakdowns, and that can happen very frequently at the early phase because we're still going through the education process as far as how can we help this person best communicate, not only from the speech therapy end but also for other medical providers. How can doctors and nurses best involve the patient in in discussions, things like that. So there's a lot of moving parts at that kind of first level of acute aphasia.
Your response was rich. I mean, you talked about the interdisciplinary, speech language pathology not being the end all be all, but a critical component of that interdisciplinary care approach. So glad you highlighted that. And then some of the issues, the frustration, the way you described, how a patient and then how staff, may get frustrated at how those things are playing out with a so it takes me back. Yes, that is a difficult piece to overcome. What are some more of the common cognitive delays? Let's talk about that for a little bit that people may experience after a TBI.
Yeah, so switching gears to TBI, that is a very loaded. I feel like all these questions, it can be so loaded just because, again, everybody can have, such different presentations. I know a model that's pretty frequent in terms of brain injury recovery and kind of staging where the person is the Rancho Los Amigos scale of cognitive functioning. And that's a multi-step scale as far as, how the person responds. So are they, in essentially a comatose state and only able to react to painful stimuli? So providers, it sounds mean, but it's a way that we can assess how the brain is processing information. A provider might go and kind of pinch a nail bed or rub really hard on the sternum, the breastbone here, to see, is that patient going to withdraw their hand, or are they going to kind of, moan and groan to the fact that their chest was just rubbed like that. They can go from there to agitated, not understanding anything. Very early on, I'd say kind of the universal winking factor for brain injury really early on are a lot of memory impairments. Most brain injury survivors, when you ask them, tell me about what things were like in the hospital, a lot of them just cannot do that because the memory system is not working that earlier in recovery. Which directly ties into the attentional system. The brain is going through a lot of noise, where with a brain injury, a lot of people will think, they had the brain injury here, let's say, but when we're looking at how brain injuries actually happen, that is the site of initial impact, something called a coup injury.
Yeah.
There's, directly draw a line to the back, there's a contra coup injury. And the brain can also kind of shift within the skull in a traumatic brain injury. So we have something called diffuse axonal shearing. So, between all of those, the brain is really coming out of a lot of kind of, I refer to as my patients as TV static, where that's, thinking back to early, 90s TV where you flip to the wrong channel, it was just that gray and black static. Yeah. The brain's really coming through all that. So it can't attend to a lot of information, which means it's not going to be able to remember a lot of information. There are filters as far as, I might want to say something to someone who gets me really upset, but I know I can't do that because it's not appropriate. Those sorts of filters, they're gone. Yes. Early on. I'd say that those are some of the more common ones, but also, you can have someone who has a brain injury and they wake up in a much later higher level phase compared to someone else. So it's really dependent.
Yeah, I like how you touched on that coup contra coup aspect of brain injury, especially when we're talking about TBIs. That bouncing around inside the skull, and the skull is not a very smooth, just nice, safe little spot. It's very rigid and jagged in some areas, and you're talking about the brain floating around inside of that and rubbing against those pieces. Yeah, it's very it's a wonder we don't see more TBIs than we do these days. I always feel like. So it's kind of an amazing process. I know we're kind of at the end of our time for our first episode, so I want to ask you one last question, and it's kind of a big, broad question, but can someone really ever fully recover from a brain injury?
There are a lot of factors that go into that, and I do get that question a lot as a speech language pathologist. I mean, a lot of the things that we work on do tend to be central to a lot of people's lives. So their ability to communicate, their ability to eat and drink safely, things like that. So I do get that question a lot, and what I will tell my patients is, I wish I had a crystal ball and I could tell you how far you're going to go as an individual, but I will highlight factors that are critical to recovery. And I mean, a lot of that comes down to motivation. Is the person that I'm working with willing to put in the effort? Because I bring all the tools, but I can't do the therapy for my patients. If you're a survivor of a brain injury listening and you're working with a therapist, they can give you the tools, but it is up to you to kind of pick them up and roll with that. So that's a critical piece. The extent of damage is another critical piece. I mean, if we're looking at a lot of brain tissue being damaged, the likelihood of full recovery is a lot less compared to, less brain territory injured. And another piece that I feel unfortunately does get overlooked a lot is the support aspect, whether it's family or friends, coworkers, whoever that person has. Everybody needs a community, because you're going through this process. I mean, it's hard for non-brain injured individuals to really appreciate how hard therapy can be, and sometimes you feel like giving up, and that's where that support comes in, where you might feel like giving up, but you have your kind of cheerleader section rallying you on there, and keeping you honest and moving forward. So, there's other factors outside of that, but I don't like to say that, full recovery is totally attainable, because it's not going to be the situation for everybody, but dependent on factors, some people might experience very nearly, full recovery. Others, it's more kind of adjusting to, where things are and learning what your skill set is and how to live life to the fullest at the level.
That's a great answer. I like how you didn't really sugarcoat it. I mean, brain injuries are very complex. They're very serious. So I think honesty is always the best approach from the get-go. So I definitely appreciate that. I like to think that's where we, at Shane Smith Law, try to step in and help as well, to get our clients connected to or find those available resources like teams like yourself to help them recover more fully. So I appreciate your answer, Zach.
Of course.
Zach, is there anything else you wanted to add on to this episode before we sign off for today?
Yeah, I mean, since we spent a decent amount of time talking about aphasia, I'll just kind of put my plug out there, because aphasia is still a relatively, largely unknown disorder. People with aphasia are just that. They are people. And unfortunately, a lot of times they can experience, I'll use the word prejudice, where because they have a difficulty communicating, a lot of times people might kind of give them, like a stare, or like someone is, something's going on with that individual, and you really don't know what's going on with them. But if you're willing to give the time to that person to communicate, you can ask them if they need help communicating. They're people. They come with their own set of experiences, emotions, and they do deserve to be heard, and they do deserve to have that time to be heard.
That's excellent, Zach. The consummate advocate, I can see. That's a great way to end today's show. Well, everybody, that's going to do it for another episode of Mind Matters, Navigating Head Injuries and Concussions. Again, I want to thank our friend Zach Smith for joining us today and sharing his insights and expertise with us. Please look for him and the Constant Therapy Health team at constanttherapyhealth.com. I hope that our audience has enjoyed listening to this interesting and enjoyable discussion and is leaving with a deeper appreciation and a curiosity for innovative approaches to treating brain injury. Before you leave, be sure to hit the like button and also subscribe to our channel so that you can stay up with our latest content. Leave us a comment below to let us know what you thought of today's discussion. And as always, remember, if you're in pain, call Shane at 980-999-9999. See you next time.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.